Hey, this is Dr. Chris Nelson here, and we have a special guest on our YouTube page today, Dr. Cam Lamb.
Hey guys.
Dr. Lamb and I, we're buddies. We ride mountain bikes together, and Dr. Lamb, his office is right down the street from ours, and he's a good guy, and we work together a lot. So he said, "Hey, I want to see your video set up for YouTube," and I said, "Okay, come on over." And then I said, "We're going to record a video."
We're here doing this.
So here we are. So with no preparation, and I said, "Hey, let's talk about a topic." So we actually used ChatGPT to come up with a topic for you all. And this particular topic, what did we pick?
We picked the number one thing, which was when to see an orthodontist.
When to see an orthodontist. And, that's a good question. And that's something that we deal with in general dentist practices. We have patients that come in and they go, when should I, because we're seeing the whole family. So, mom will come in and their kid's not even in the chair. They're just saying, when should I have my kids see the orthodontist? And so, I'll have an answer. A lot of times it depends.
Yeah.
But then, probably the same thing happens for you too, because you have a mom with usually it's the moms.
Yeah, there's always the moms.
Yeah. So mom with the kid maybe one of their kids is already in treatment, and then the other one's in the room, and they turn to you. So I'll be the mom in this scenario, and I turn to you and say, "Dr. Lamb, I got little Lisa here, and like when do I have her see you for a screening?" Well,
when to come see me, the orthodontist, like when should I be like concerned, all that.
Yeah.
So, you can give like the scientific one and all that stuff. So we have like the governing body who tries to give us the scientific, when's the best time. And so they always recommend around age 7. That's kind of our guiding kind of principles. And the big thing that's guiding that is the permanent teeth. That's really where we start really caring about really what's going on, is when you start seeing those adult teeth starting to come in. So go ahead.
Oh, so I'm thinking the 6-year molars are in all the way.
Yeah, or starting to at least come in, so we can kind of see really what's going to start happening with where things are going to kind of set up for us. And
so I'm going to look into my daughter's mouth and go, "Oh, I do see there's those molars back there."
Yep.
And then maybe at that age, there's also some new permanent teeth. Maybe not the permanent upper teeth yet, but the lower ones are in.
Yeah. Yeah, you might start seeing those they might have lost some front teeth.
Yeah.
They might have started to get some really big front ones that are starting to come in.
Yeah.
They might start to get that shark teeth kind of look kind of thing. Those are kind of when we start to kind of see, hey, now we can kind of see how things are kind of develop.
Yeah.
So it kind of sets us up for this is where kind of things are kind of going on.
Okay.
And I also let them know hey, just because you're coming to see me, this does not mean that hey, you're getting braces.
Oh, that's
today. That's what I always let people know. It's we're just checking to see how things are at.
Yeah.
It doesn't mean that you're getting braces today, this is definitively.
Yeah.
We're only doing stuff if it's gonna help kind of thing.
Yeah.
Right?
That's a good question, because the referral partners that I work with, like Dr. Lamb and our other partners, we have a bunch of different partners for different things. Yeah. And I will send patients to Dr. Lamb that I think will do really well with Dr. Lamb.
Yeah.
And but sometimes patients think, "Oh, well, if you send me to the root canal specialist, they're for sure going to make me do a root canal." And, maybe in some other towns or some other markets or with other specialists, that could be the case. But our referral partners are good, ethical people, and we know them personally. And, I can text all of them with, extra information about, hey, I sent someone over to take care of them.
Yeah.
And that's our referral partners, they will for sure tell you the truth and also what is best for you. The other thing we could look at is, our referral partners are busy enough without one extra patient.
Yeah.
So, that's one way you can look at it. Another way is just at the ethics side. They're good people that are not going to be looking at, the analogy I make is if you go to a hammer store, the only thing they're going to sell you is a hammer.
Correct.
And sure, but our hammer store specialist will also tell you don't need a hammer.
Yeah.
Right. So, okay, that's a good one. So at age 7, and then what are some other things to look out for on when to see the orthodontist?
And it's really age 7, that's kind of just the guidelines.
In general.
Yeah, the guidelines. And it's really you have any concerns, like you're just like, hey, like maybe like Johnny, your neighbor, like they brought their kid in, and you're just like, everyone's just kind of worried, like maybe I should have my kid come in, or
Yeah.
hey, my kid's doing X, Y, and Z, like they're chewing weird, or like they're having some kind of weird habit, they're sucking their thumb. You're concerned about some kind of weird thing going on with their teeth or their bite. Hey, have them see the orthodontist. It doesn't really matter. Like, we're here to answer questions for you. I like to make things visual, so I take pictures and I show you everything that's going on. And I just want to make it so you know what's going on. And if there is something we can do, we can make a plan. But if there's not anything to do, then at least we know in the future kind of what's going to kind of happen, just to kind of make things easy for you.
Yeah, that's a good point, because as we look at our little kiddo patients, we're keeping them in that they're going to be our patients for a really long time. Yeah. So sometimes I know you'll do a screening on a patient and then determine that the patient actually isn't ready for ortho, but they might be in the future. And so a lot of times you'll set like a 6-month recare appointment, or a reminder to say, hey, come in 6 months, we'll check it again. Or do you ever do like an annual thing, or is it usually like...
I usually just do 6 months, and they're really just fast, easy, quick ones. Yeah, just to make sure everything's just, nothing crazy is going on, and just make it quick and easy for you.
So one last thing, what are some, I have two questions. One, what is the most adorable age in your practice with their smile? What's the most, like, every time you see a kid that's that age, you're like, oh man, that kid's so adorable because of their teeth.
Because of their teeth, yeah. Well, I always love it when they get the front two, and they usually got like the big spaces. That's like the best ones.
That's the best.
Or like when they first get like the first teeth, like the baby when he starts getting those first ones and they smile and you first get the first teeth.
Okay.
Love that phase.
Okay, cool. Second question, do you do anything special when braces are done? And can you tell me, or is it a secret?
No. We like to celebrate. Getting braces off is a big thing. So we like to do a celebration, is what we call it in our office, where we try to get everyone lined up in our hallway, and then we make it a big deal when we get your braces off. We play a song. We like you guys choose your own song, but sometimes I like to use our song, and then we make it a big deal when you get your braces off. It's a big deal to get them off, and that's what makes the job fun. Is when we get those big reveals. When the braces are off.
Right on. Well, maybe one of these future videos, I'll come over and we can pretend I just got my braces off, and we can do the reveal for me.
Nice.
And I'll pick a fun song, but I'll need to think about what song I want to play. Okay, that's it. Thanks for watching, Dr. Chris Nelson and
Dr. Cam Lamb.
And where can they find out more about you? Social or website? What do you got?
Yeah, so we got Lamb Orthodontics. Then you can also find us at lambortho.com here in Redding, California.
All right, yeah, and Chris Nelson, DDS on YouTube, and nelsonfamily.dental, our website. We'll put some links in the description and on the YouTube page. Okay, take care. You guys have a great day.
Awesome. Thank you.
There we go.